Not every workplace injury involves blood or an ambulance. Some of the most debilitating injuries happen gradually, over months and years, as repetitive motions and excessive hours systematically destroy workers' bodies. These are the injuries that employers love to deny because there's no single dramatic moment to point to, no clear line between before and after. Let's talk about the mechanisms. Repetitive motion disorders like carpal tunnel syndrome and tendinitis occur when the same movements are performed over and over, causing microtrauma to tissues. Your tendons, nerves, and muscles can handle a certain amount of stress, but they need recovery time to repair. Every time you use those tissues, you're creating tiny amounts of damage. During rest, your body repairs that damage and the tissues become stronger. But if you never get adequate rest, if you're working overtime constantly, the damage accumulates faster than your body can repair it. Postural stress is another major factor. Prolonged standing causes venous insufficiency and joint problems. Prolonged sitting causes disc degeneration and muscular imbalances. And when you're working 10, 12, 14-hour days, you're exceeding what your body's tissues can tolerate. The loading is cumulative, and eventually, something breaks down permanently. Here's where overtime becomes particularly destructive. Your body needs recovery time. If you're working a standard 40-hour week, you have evenings and weekends for tissue repair. But when you're working 60, 70, 80 hours a week, that recovery time disappears. The damage accumulates. And unlike acute injuries where you can point to a specific incident, cumulative trauma injuries develop slowly enough that workers often don't realize how badly they're injured until the damage is severe and potentially irreversible. The compensation challenges are significant. Employers frequently deny gradual injuries, claiming they're not work-related. They'll argue that the carpal tunnel syndrome is from video game playing, or the back problems are from poor posture at home, or that it's just natural aging. Never mind that the worker's job involves repetitive, forceful gripping for 10 hours a day, or lifting patients without adequate mechanical assists, or standing on concrete floors for entire shifts. The burden of proof falls on the worker, and proving causation for gradual injuries is much harder than for acute injuries. What can workers do to prevent these injuries? Ergonomics becomes critical. Proper workstation setup, appropriate tool design, and correct technique can significantly reduce tissue stress. Scheduled micro breaks allow tissue recovery even during work shifts. Strength and flexibility exercises can protect vulnerable tissues by improving their capacity to handle stress. But let me share some case studies that illustrate the human cost. Factory workers in their 40s who can no longer use their hands due to severe carpal tunnel and tendinitis. They've had multiple surgeries, none of which fully restored function. They can't work. They can't perform basic tasks like opening jars or buttoning shirts. Their careers are over, and they're facing decades of disability. Warehouse workers with permanent back damage from years of repetitive lifting. They're on pain medication constantly. They can't play with their children or grandchildren. Simple activities like grocery shopping require planning and recovery time. Healthcare workers with destroyed joints from years of lifting and moving patients without adequate mechanical assistance. Nurses in their 50s with knees and backs so damaged they need joint replacements and can no longer work bedside. These workers' bodies broke down, creating profit for their employers. And when they became too injured to continue working, they were discarded. This is the economic injustice at the heart of cumulative trauma injuries. The profit is privatized, but the cost in destroyed bodies, lost income, and medical expenses is borne by workers and society.